Senator to welcome us this morning.
Thank you very much. I want to welcome every one of us this morning to this Health Watch series, which is the first this year. And it's all about, we're going to be talking about managing stroke. I want to say Happy New Year to all our members and all our friends from all over the world who are taking part in this. And I want to sincerely say that you are welcome to this webinar and to the other activities we're going to have this year. You've all had the good news that our bill, which has been passed by the National Assembly, has been transmitted to the Mr. President for his signature. Let us pray that he signs it. And as you all know, that bill will provide the backup for all the policies that are going to be made in this country in the future. Because without policy, with policies, different governments change policy. For example, when Fayemi was in Ekiti State the first year, older persons were being given allowances. When he left and another person came, policy was changed. But if we, with the bill and with the laws, once those policies are hinged on the law, nobody will change them again. So that's why it's important for us to be able to ensure that the president signs this bill. And of course, you will know it will be the first bill that will protect older persons. The women have their bill, the children have their bill. There's no legal protection for older persons except this bill. And when it happens, we will be joining about 4 other African countries that have legal protection for their older persons. So I want to welcome you to this discussion. And of course, you know also that as Health Watch, this is connected to what older persons will be taken care of health-wise. And I'm glad to report that the committee that the Federal Ministry of Health has set up is working very, very hard to ensure that in future, all our older persons have health insurance. So a lot is being done at this moment in this area. But talking specifically about today's topic, which is managing stroke. Many older persons, as you know, are suffering from diabetes, some hypertension, and most of these people are at the risk of having stroke if they do not manage their sicknesses very, very well. So it is my hope that as we discuss today, that the discussion will include how to ensure that we do not have problems that would lead to stroke, which normally are as a consequence of a blocked artery or a burst artery, or blood not getting to where it should be, leading to paralysis and all that. Having said that, I want to welcome all of us to this interesting topic, and I'm sure that our sister, Dr. Karumbi, will do justice to this because she's been known as a specialist in this area, and she's a consultant in the area. And therefore, on behalf of the Coalition of Societies for the Right of Older Persons, I welcome both our guest speaker and all of us who are here. Welcome. Thank you very much.
Thank you very much, President, for that brief address. Actually, today we have one of the best people to address us this morning on this issue. She is somebody who has been in the aging sector. I've known her for a long time. Most of the seminars we go to, she's always there. She's been in the aging sector for a very, very long time, and she's highly qualified to address us on this issue. And we are glad that she accepted. She always accepts to be one of our guests anytime we want to disseminate information. And we are really grateful for this. Sometimes it could be very sudden. Sometimes we could. But she
Sandra.
always obliged, and we are grateful for that. Speaking to you this morning is Reverend Victoria Ono. I am the Secretary General.
This ones are showing their names. My own is showing my there. How can it show my name?
Please, can you mute that? So I am the Secretary General of the.
But when you are done, you have to do it. Go to your settings and change the name that would appear.
After this one?
Yes, you can't do it in the middle of.
In the middle of the.
Yes.
If I pretend to start again.
Okay.
Please, can we concentrate and keep our mics muted, please, so that we can have a smooth deliberation this morning. Once again, I want to introduce myself. My name is Victoria Ono. I'm a reverend and an architect by profession, and I am the Secretary General of the Coalition of Societies for the Rights of Older Persons. I'm here this morning to guide us through this program, and I know that it's going to be an exciting time. And for all of us that have made it so far, we are grateful to have you here. And we hope you just put your hands on that dial and tell people what is happening, because they are going to be educated on something that is really present with us, and that is stroke. And to handle this topic ably is Dr. Temitope Farombi, MBBS, FMCP, Neurology. She is a graduate of the University of Ibadan, and she trained in internal medicine at the University College Hospital, UCH, and neurology at UCH Ibadan, Nigeria. She obtained her master's degree in clinical neuroscience in King's College London. She is a consultant neurologist at the Chief Tony Aneni Geriatric Center, University College. You would want to also know that this center is one of the foremost centers on aging in Nigeria, and the first integrated elderly care center in West Africa sub-region. She specializes in the critical care neurology of older persons, movement disorder, dementia, and headaches. She was a visiting scholar to the Northwest University, Chicago, USA, and Haztop University, Ankara, Turkey. An international keynote speaker on many issues of chronic neurological disease in the elderly, a member of many learned societies, including Movement Disorder Society, Nigerian Society of Neurological Sciences, regular presenter she is at conferences, and has published articles in scientific journals. She is on the board of medical and scientific panel Alzheimer's Disease International, convener of Dementia Not Witchcraft, and founder of Brain Health Initiative of Nigeria, BHIN, an initiative poised to promote healthy brain across life. And meeting better person to take today's topic than Dr. Farombi. You are very welcome. Please, you can take the stage.
Hello. Hello, can you hear me?
Yes, we can. You're very welcome.
Sorry. Thank you. Sorry, I think the network here is very unstable. But I've shared my screen. Have you seen my screen? Can you all see my screen? Shared screen?
Not yet.
Okay, I'll share it again. Thanks for the introduction. I'm just going to see if I can share my screen again. Okay. Okay, can you all see my screen now?
Yes, yes.
Yes, we can. Are you hearing them?
Yes, we can.
Okay, thank you. I'll appreciate if you all can mute your mic so that we can hear us properly. My name is Dr. Temitope Farmbi, and thank you, Reverend Mrs. Onu, for that introduction. This morning, I'll be talking to us on stroke presentation and management. Of course, stroke is commoner in the elderly, has one good, because age is one important factor in stroke presentation. And as I continue to explain about this topic, which has attained the level of what we say pandemic in our society, because it's now one of the commonest medical emergencies in the hospital now. However, it is largely unrecognized, and also there are so many perceptions around it, and also denial. So I'm just going to open our mind to what stroke is, how it presents, and how we can better manage it. Most important thing is to be able to identify the symptoms, identify the risk factors that can make someone to have stroke, and see how we can reduce the risk factor and also reduce the untoward damage that stroke might cause by presenting early to the hospital. Okay, so this is the content I'll be talking about. Of course, I'll try as much as possible to avoid medical jargon. I'll be talking about the introduction of stroke, the type and risk factor of stroke, a bit on the mechanism of how stroke occur in humans, the signs that you should look out for, and the symptoms, as well as some investigations that we often request people to do, and things that can make stroke outcome to be very bad. And then I talk about prevention as well as management. So here, so simple as it's a neurological deficit. I'll put it simply. Stroke is what we call brain attack. The way we say heart attack. So stroke is brain attack. And most times is usually located and localized. So it's not like it is generalized brain attack that we see in form of generalized headache. It's usually very, how do I put it? It's focused. It causes focal injury to the brain. Not all the brain cells are injured at the same time, because most times blood flows to different parts of the brain, and it is when that blood flow to that part of the brain is affected that causes stroke. And that is what I mean by it has a vascular cause. It's caused by problem along the line with the blood vessels that supplies the brain at one point or the other. So it's of vascular origin. And this is very important because for a clinician like me, some other things can present that may look like stroke, but they are not stroke. So that is why if anything that is not of vascular origin, we won't say it is stroke. And it's not only your hand and your leg that it affects. It also can affect the spinal cord. It can affect the eye. I was reading on one of the social media early this morning when someone said they suddenly present with sudden blindness. It might actually be another presentation of stroke. So, and it's heterogeneous disease. It has different subtypes. It can be as a result of burst of pipe or blockage of pipe. So these things present differently. But I won't bore you with that. It's just just like a general introduction to what the topic I'm going to be talking about. So Stroke is a major cause of disability and death worldwide. Actually, is the second cause of death following cardiovascular events, and also is the #1 cause of disability worldwide. And it's increasing daily. And we in Nigeria, we globally we have over 200,000 new cases. And like as it is right now, it is the #1 emergency here at University College Hospital at the ER where I practice. So what is stroke? So stroke is, in a simple term, brain attack as a result of infarction, blockage, or burst, hemorrhage into the brain. But this time around, it can actually affect the spinal cord also, and as well as the eyes that we call retina. And it can be, like I said, is blood vessel related, and it can cause permanent damage or lead to death. So what are the risk factors for stroke? We call some things non-modifiable risk factor, that there's nothing you can do about it. It is sacrosanct. Like age is #1 thing. As we grow older, the risk of developing stroke also increases. So, and there's nothing you can do about aging, and that's why I'm happy when COSROPIN approached me to say I should come and give this topic, because it's really, really important, even as one ages. Of course, gender, male factor. Being a male poses a higher risk at you for developing stroke. That is before menopause for women. But after menopause, like older women, the risk is almost at par, and oftentimes even go beyond that of men. Of course, race, being Black also, because there's studies that have shown that Black handles hypertension poorly. And so being Black has posed the increased risk of stroke on us. Yeah, unfortunately, also poverty is one of the things. Those are modifiable, and stress, those are modifiable risk factors. Hereditary. Some people have genes in their body that can actually affect the blood vessel and can then increase the risk of stroke. There's nothing you can do, it's genetic, so there's nothing you can do about it. And also previous vascular events. If you had previous stroke before, it is a high chance of you having another one. So what are the modifiable risk factors? The modifiable risk factor is where we do a lot of intervention. Because the non-modifiable, there's little or nothing we can do about that. We can't change your sex, we can't ask you not to go older, and also we can't change your genetic makeup. But of course, the modifiable ones, we have hypertension, people with hypertension, people with heart disease, like rheumatic heart disease, different types of heart diseases, and people with diabetes, people with high cholesterol, hyperlipidemia, and people who smoke excessively and drink alcohol excessively. Of course, people with social deprivation, those who don't go out, who stay just in one place, and have issues, stress condition, of course, obesity and sedentary lifestyle. These are all modifiable risk factors. What do I mean by being modifiable? These are areas where we can do a proper intervention without having to proper intervention, and intervention at this stage can reduce the risk of stroke even by more than 50%. But there are different stroke types. That's why in my introduction I said it's heterogeneous in presentation. The commonest one, and the one seen mostly in adults, is the ischemic one. I'm not going to bore you with medical jargons, but ischemic simply means that there is reduction of blood flow to a region of the brain that makes the brain cell to die. And it can be as a result of either it's a thrombus or an embolus, but I'm not going to bore you with that. And the rest, the least common one is hemorrhagic stroke. This is as a result of blood vessel bursting in the brain. So all that I've listed, the risk factor, can cause both both ischemic and hemorrhagic stroke, but the one that we see commonly and the one that is commoner among the elderly is the ischemic stroke. So what is the pathophysiology? I mean, the mechanism at which stroke develop. Of course, the brain lives and thrives on glucose and oxygen. And these glucose and oxygen are supplied by the blood vessels. They are carried by the red blood cells in the blood vessels. So, and it receives about 15% of the total output of the heart. All the blood that the heart pumps out, the brain receives 15% of it. And of the oxygen that the blood vessel gives to the body, the brain takes 20%. That means 1/5 of our total oxygen goes to the brain. So what that means is that brain is dependent on glucose and it's dependent on oxygen. So any shortage within seconds and minutes of this shortage of this major supply to the brain will lead to stroke. So of course, there are body mechanisms that help to maintain this flow. That's how God has done it. So those are what we call autoregulation. That is, there are occasions where your blood is too high, blood pressure is too high. The body will adjust your body system to kind of manage. It's only when those autoregulation mechanisms are overwhelmed that it leads to breakdown of total body. So we should always listen to our body when we start feeling somehow. And that's one of the reasons for importance of regular body check. So it's very important. And next slide. Okay, so like if blood flow, if the brain lack blood flow for just 4 to 10 minutes, the brain will die completely, the tissue will die completely. But if the blood flow is reduced, that's where we talk about, okay, maybe infarction, that is sickening of the brain cells. But if the blood flow is less than 20 mils per 100 grams of tissue, then this becomes an issue, and then the brain can eventually die over the extended period of minutes to hours. So I've talked about hemorrhagic stroke is an explosive bursting of the brain blood pipe suddenly into the brain structure. And the next one is ischemic stroke, which is blockage of the blood pipe that supplies oxygen and glucose, as I've earlier mentioned. So this is a picture that shows what happens when blood supply to the brain is affected. You can see some area here. The red part, that is, there's a zero blood supply to the brain. So there is absolutely nothing anybody can do. This area is dead. That means there's zero blood supply. However, the one, if you watch my slide the other time, I talk about reduction in blood supply. And this is where this pinkish area, not the red area, the pinkish area of the brain shows that the cells are sick. However, if you present early to the hospital by identifying the symptoms early, and we could quickly do intervention, then we can salvage this pink and the very blue area. That is it. We can salvage the pink and the very blue area. But the dead, the red area is an area of the brain that is dead, and as a neurologist, there's nothing anybody can do about that. However, the pink and the blue area can be salvaged when you present early to the hospital. So what are the signs? Oftentimes, the signs are often fluctuate and we may not know it. But the most important one is that it is sudden. Perhaps the person is okay, the person sleeps very nicely, and everybody say good night, Papa, good night, Mama, and Mama wakes up to go and ease himself herself, or Papa wakes up to go and eat himself, and suddenly there's a change. Maybe they drop, one side of the body cannot be picked up, or is heavy, or they notice a twist in their tongue, and even they couldn't even pronounce whatever words they are saying properly. So that is it. Is a sudden onset. One can be talking to a friend and all of a sudden the voice changes and there's a weakness, and somebody can then fall down, or you are doing an active event, dancing, and it comes suddenly. So it's a sudden. So that's one thing that we should always look for. Somebody that was otherwise okay and suddenly present with the symptoms. I'm going to elaborate further. Of course, like I mentioned, a lot of people, they present very late to the hospital because they have this denial. If they say, okay, mama, I think you're having, so they say, God forbid bad thing. So the mindset, the denial, and also hoping that, okay, this weakness I am experiencing, it will get better. Let me tell you, let me just encourage you, so that if you see anybody with sudden, I beg you, take that person to the hospital. The longer you stay at home or you delay your presentation to the hospital, the delay your recovery, or even the recovery may not be possible. So oftentimes the person that have that stroke is not the one that presents to the hospital. Family and friends, maybe someone who saw you or who sees that person, rush them to the emergency room or doctor's office for stroke presentation. But there's special presentation for the elderly, unlike the young one, because as we grow older, the brain also grows older and the brain cells shrinks. So it gives room and space in the skull, such that when the accident happened, the attack happened, like I've mentioned, it does not quickly present in a very way that a young person will present, because the cage in the brain, the space in the brain is wider, so it allows for swelling, unlike a young person that has, like somebody in their 40s or in their 30s, the space in their brain is not as wide, so the deficit is instant and is very obvious. But for elderly, it may not just be something that is too obvious. Perhaps you just notice that when you are picking a cup, it drops, and that is a sign of weakness. Or when you want to say taller, you say roller, that means there's a twist in your tongue. And so those are signs that elderly can pick. So oftentimes you may not see the suddenness that we see in the young adult compared to those who are very old. So that's why index of suspicion must be very high. And you should be able to say, oh, mama, there's a change in your voice, there's a change in your speech, or there's weakness in one side of the body. So these are the things that we need to look out for being an elderly. So, like I've mentioned, prompt attention is crucial. At least if symptoms come, or sometimes symptoms can resolve completely, but however, you cannot make diagnosis of, okay, it has resolved until you do a brain scan. So these are the things. Oftentimes, these are things I've mentioned is the onset. The key finding is that the onset is sudden, and also the duration is very short. And of course, it's less than 3 hours. And of course, as a doctor, I will ask if there are previous history of strokes to identify risk factors in this patient. So, like I said, not all suddenness is stroke. Sudden loss of consciousness, sudden change in voice, or change in the muscle power of one side, not all of them are stroke. Other things that can present in form of stroke, somebody could have a growing tumor in the brain that can compress one side, and then it can present with weakness, but it's not sudden. And someone can have a seizure. Seizure can be as a result of complication of stroke, but there are some people that have seizure and they don't have brain vessel damage, and that will not be stroke. So there are other causes of stroke, even migraine headache. People with very severe headache that makes them to feel weak, and blurring of vision also can be a differential diagnosis for stroke. So what are the investigations that we often request for? Oftentimes they will say, they ask us to do all this, do all that. So we request for blood, because we know thickness of blood also can actually cause flow of the blood vessel to reduce, and it can actually reduce the blood flow to the brain. Of course, we request for the clotting profile. We do your ECG, echocardiogram, and we also request for brain CT. Brain CT is sacrosanct or MRI. I cannot make that the diagnosis of stroke and better treatment of stroke without brain CT. So part of what I will want to also beg the coalition is to also see how we can get special funding even for hospitals that are dedicated to the elderly, such that, because we know that this is one of the commonest diseases that affects the elderly, that at least minimum of brain imaging can be present in those places. So these are the CT image of somebody who has had stroke. You can see normal brain tissue and the ones that have been affected by stroke. Okay, this is the one that I talk about, blood bursting into the brain. You can see the difference between this one as a result of blockage of blood flow and this one as a result of bursting of blood vessel into the brain. So they are two different, and you cannot know this until you do a brain CT. So you don't always say, they are just asking us to go and do tests. We don't know the reason. So that's the reason. Of course, we give medication when patient presents with stroke. I won't bore you with that medication, but these are the types of medication we normally give. So before I round off, so the simple physical symptoms that you see, there's something we call FAST. FAST, the F there represents the face, that is abnormality, asymmetry of the face. When you notice suddenly there is maybe a drop on one side of the face, and this A there is harm, weakness of the arm or the leg, and the S there is speech, sudden change in the speech of that person you are talking to, and the T there is time, bringing to the hospital. Important, is very, very important that you bring the person straight to the hospital. So aside giving medication and treating, we ask you to do physiotherapy to strengthen the muscle that is weak, and also put out the TED stocking to avoid blood vessel, slowness of blood vessel. Of course, sometimes some people might require surgical treatment. So here, stroke prevention. Like I mentioned, if you listen to me about the modifiable risk factors, if we are able to control this modifiable risk factor, we can reduce the chances of anybody having stroke by 50%. And I tell you, that is a great reduction. So what are the stroke prevention? How to prevent stroke? Blood pressure control. How do you know? You must constantly and regularly check your BP. At least if you have been, at least once, if you are normal and you know that your BP, at least you do it once in every 6 months to know at least, okay, let me just check. But however, if you have been diagnosed to be hypertensive, hypertension is not like malaria that goes immediately. It does not go. So it requires medication and modifying some lifestyle to ensure to keep the blood pressure at normal as other people that don't have high blood pressure. So if you're able to control our blood pressure, so all these things also will reduce stroke. Our dietary modification. A lot of people still eat this unhealthy, fatty food. They put like 4 or 5 meat on their plate, like a sign of enjoyment, and we do a lot of frying and oiling of the food, and we eat less of vegetable. Studies have shown that eating a lot of green leafy vegetable, not the one that is overcooked, has preventive have a way to prevent people from developing stroke. This study was done here in Ibadan, and I'm happy to be part of that study, Siren study, and we've been able to identify green leafy vegetable as a protective measure. So go out there and make sure that you put vegetable in all your meal, and as much as possible, avoid overcooking it. Of course, dietary modification, eating a lot of fruits that gives antioxidants, and avoid as much as possible additional sugar in your meal. Of course, anticoagulant, those who sit down a lot, we know of the story of how aspirin can protect especially those who are at higher risk of developing stroke, and also control of blood sugar, which is very important also, because blood sugar, excess of blood sugar causes reduction in the flow of blood in the vessel. So if you're able to control it, it allows the flow of blood to be normal. So we need to control the blood sugar for those who have diabetes. However, how do you know that you don't have diabetes if you don't check it? So regular checkup is very important. And lifestyle modification, regular exercise, social outing, that moderate social outing, exercise, dancing, meeting with people, having been around family members. These are very good things. For those who drink excessively, stopping, reducing it to the barest minimum, and stopping smoking completely. These are lifestyle modification that can prevent stroke. And if we abide it, abide by it, we are sure that at least we can reduce the risk of stroke by 50%. Thank you for listening. So I'm open to question. Hello.
Hello.
Yes.
You're muted, ma.
Okay. So like I was saying, the end came so fast. But that was very well delivered. Just give me a second, please. Let me correct some things. I want to be on this one. Just a second. Is to switch this one off. Okay. Can you hear me now?
Yes.
Okay. Thank you very much. Thank you, Doctor. That was a very well delivered talk. It's very direct and very simple, not too much medical terms, and quite understandable. But before I open up for questions, I just want to reiterate some of the things that you told us that be nice for us to keep on our fingertips. And that is one of the things that resonated with me was one, that stroke has, is number one, this number one problem that stroke causes is disability, and that is blood vessel related. And you went on to tell us, amongst others, that the risk factors are basically age, being a male, and being Black, and also hereditary or genetics. But these ones that you mentioned, you said they were things that you can't really do anything about. But the ones that we can, you said you call them modifiable foods, the ones that we can do something about is the smoking, drinking, social deprivation, stress conditions, and the sedentary lifestyle. And you told us that this can, once we're able to take care of these, hello? And you told us that once we're able to take care of these, amongst others, we could reduce the risk by up to 50%. And good to know that, or at least we can do something about it, because what is out there is like stroke is so silent, you don't know what to do. Once you are getting older, expect it around the corner. But from what you've told us today, it's like basically we are in control. So it's like basically we are in control of what happens to us as we get older. Another interesting thing that you talked about is that one of the things, maybe we'll take another talk some other time, and you would oblige us as we concentrate and go into detail on brain health. you know, how to maintain good brain health and all that, because you talked a little bit about it, about the importance of blood supply and oxygen supply and so forth. So we'll definitely be calling you back, if you don't mind, to take that very soon. Another interesting thing was that you said it presents, it's more obvious in older persons than it is for younger people. And then I remember you asked us to do something about funding for hospitals so that they can give more attention to older persons, especially for CT scan and brain imagery. Well, you've told us so many things. At this point, I want to stop and see what some people have to say, you know. Can we take Mary Angela? Can we take your question? Mute my phone, please. Mary Angela, please, can we take you? Don't worry about that, just put it on. I want to check the chat. Okay, your hands are just up. Do we have any other person with questions? Do we have any other person with questions, please?
Hello, can you hear me?
Yes, we can now.
Hello.
Hello, we can hear you.
Network is.
Okay, while we're waiting for more questions, Doctor, you talked about some of the things we should watch out for in terms of prevention or watching out for early signs. You said the acronym was FAST, and F for face, A for checking out of the arm, and then S. I missed the S. So what is the S? And then you said T was time. What was the S, please?
My network has been very unstable. I want to believe this is the first question. The S there is speech. Speech. Okay. F is for the face, A is for arm, S is for speech, and T is for time.
Okay, the host is not permitting somebody to unmute. Could you do something about it? Okay, thank you very much. So F is for face, A is for arm, S is for speech, and T is for time. We should get to the hospital on time. And then the speech, when we have slurry or blurry or whatever speech, it is a sign that something is happening in the brain. And then of course the arm. Recently, my mother suddenly had a numbness in her arm, and then she had to drop her food suddenly. And that made us to start rushing to the hospital. So definitely those are signs. And then while you were talking, you also told us a few things about prevention of stroke. You said that we should do checkups once in 6 months, and then we should make sure that we control our BP, taking it often, and then control our diet. A lot of us like plantain, especially when it's fried. So we should control our diet and make sure that we have less fried food, less meat, and avoid overcooking. I like the avoid overcooking because a lot of us do a lot of cooking, like we like to fry our stew. And I know that tomato is actually a vegetable. So frying it is like we're eating dead food. So we really need to watch overcooking. It's real. And then we have diabetes checkup. And then you told us that if you can't check up, if you don't check up, how do you know you have diabetes? So we need to check, find out our state of health. Regular exercises is very important. And that brings us to discipline because you just have to take those walks every day. And I hear that we need to do not less than 10,000 steps every day. I do like 45 minutes. Sometimes I could go to 1.5 hours, but sometimes I don't do anything at all. So may the Lord help us Then for those that have some naughty habits like smoking, it says stop it altogether. And then drinking, reduce drinking. I would say stop drinking, but doctor says reduce drinking. So we'll take somebody here, Felix Oko. Can we have your question, please? Unmute and give us your question.
Afternoon.
Good afternoon.
Good afternoon, Victoria. I just want to refer the speaker to the chat room. There are some comments in the chat room, people who can't unmute. They have placed their comment on the chat room so that she can handle them.
Okay. I think you should be able to unmute everybody now. Operator. I think they should be able to unmute themselves and ask their questions by themselves. But in the meantime, Dr. Farabi, could you oblige by checking the chat?
Okay, if I'm going to go through the chat.
Yes.
Yes, I'm going through the chat now, and someone said it's 6 months. Mary Angela said it's 6 month check for hypertension, not too long for elderly in particular. I'm wondering if it should not be lots more regular. What I mean by 6 month check, if you are not hypertensive, if you've done your at least minimum of twice a year, you should go for your full blood check, full body check. But if you are perhaps you are hypertensive and you are on medication, you should always at least check it once a week if you are on medication, to ensure the medication is okay, minimum once a week. But if you are not hypertensive, you are not diabetic, it's good to have at least twice a year full body check, and this include hypertension, diabetes, and cholesterol. But if you have these symptoms, like someone who is diabetic, you are expected to check it at least twice a week to ensure that whatever medication you are taking is controlling the blood sugar. It's only for general check and for those who don't have it, because somebody who did his or her BP or glucose check in January, by June, July, it might have gone up. So that's the reason why we say at least you do it within twice annually, but not that once you are diagnosed, you should do it regularly. So that is that. So even for elderly and any young adults, you should do it at least twice. And you are on medication, you should also check regularly as prescribed by the doctor. Someone here said that I should please enlighten us on some hospitals that are majorly dedicated to the care of the elderly. Of course, thankfully enough, we are having the dedicated centers across the country. The first one is Chief Tony Anini Geriatric Center here in University College Hospital, and this is its 7th year of operation, and we currently manage over 25,000 enrollees that have enrolled with us that are elderly. Of course, we have in UBTH, and I want to believe that we have some in the northern state also. So these are centers that are dedicated to the care of the elderly. I know that Lagos State also is doing one. So we have, but they are not enough because people are going old daily, and of course we know that they are not as strong as the young adults. So dedicated centers, and this is what COSROPIN and other older adult rights group also should also come aside, fighting for the right of part of the right of the older adults is right to health, and especially when we have this multi-morbidity coming up more among the elderly. So, and one thing also that we can ensure during our fight is to see how insurance coverage can actually, elderly people can benefit from insurance coverage, because they will be the ones who need it more. Okay, another person asked this question: what should be the immediate action if one experiences stroke, for if it is not degenerating to something? Your immediate action is to present to the hospital. That is the T in the fast. Once you notice anybody had just had the symptoms of stroke that I've mentioned earlier, your immediate action is to present to the hospital. That is not to say I want to go to church or to mosque, or I want to face it. Is to present to the hospital and let the doctor attend to you. let me sound a note of warning. Not all doctors are stroke experts. So please, always, if the doctor says this is stroke, please request that you be referred to be seen by a stroke expert. It saves a lot of life and a lot of gambling around one's health. So so your immediate reaction is to get to the hospital as early as possible. Okay, someone said I was just coming in from, okay, I'll come, okay.
Somebody says we have one in University of Port Harcourt Teaching Hospital.
Oh, okay, that's fine. So we are having, okay, another place. If you read through the chat, you will see geriatric clinic. However, let me sound not geriatric clinic. Someone says stroke dedicated geriatric clinic, as in that is specific for stroke. I am a neurologist and I work in geriatric clinic, a geriatric center. So that is what makes UCH a unique one, because we have a neurologist that is just specific for the geriatric center in UCH. I'm not sure if we have similar in other centers. I'm not going to be a spokesperson for them, but if they don't, they should collaborate with internal medicine and ensure that they have neurologic coverage in those centers. Thank you.
Oh, thank you so much, Doctor. You've been fantastic, Dr. Farombi. Thank you, thank you, thank you. I don't know if we're still having questions. Okay, we have one, Juliet. Okay, that's our last state coordinator. No, that's one of our COSROPIN reps. Yes, your hand is up. Could you please go ahead?
Hi, good afternoon, everyone. Can you hear me all?
We can hear you.
Good afternoon. Yeah. I'm just trying to add to what you do to help the person. Those of us who are caring for the elderly, we have some first aid experience, and they would always suggest one or two things you could do before rushing the person to the hospital. As we know that first aid also contribute to saving life before the person, or help treatment as you bring the person to the hospital. You have noticed the facts. As the facts was stated, the face shifting, you are looking at a client or an elderly person, the face is shifting, the arm is turning, and the speech is altered, and then the timely intervention includes not just going to the hospital as well, so the timely intervention could also don't prevent the person from allow the person to fall. Because if you are caring for an elderly person and you are seeing these signs and you just desert the person, run away, or trying to look for a vehicle to arrange, and the person falls down, it will worsen. I'm thinking that it will worsen the issue. Our speaker has done so much. I've learned a lot, I've jotted down, but I'm also thinking that when we talk about immediate attention or something that could be done by somebody who is very close to this victim, is to also allow the person not to fall.
Okay, awesome. Okay, I think, is that Prof speaking? I think that's Professor Nivo from Benin. Hello? Hello? Okay, from what she's just told us, I think we need to actually know what to do, exactly what to do when we see those things presenting, especially when it's like we are there at that moment. I know that a lot of us need to be trained on how to resuscitate people who have fallen or who are at the brink of stroke. So, doctor, what do you say to that? Dr. Farombi, are you there?
Sorry, the network was a bit, but let me tell you something. First aid or no first aid, like I have mentioned, it is a blood vessel that is affected, and it is in the face, in the brain, the spinal cord, and the eye. Of course, handling the patient en route to the hospital, you can prevent the person from falling, or you support the person while taking the patient to the hospital. Perhaps some people can vomit, so that is not the time you want to lie the person very flat, so that they will not.
Oh no. And it's reducing. 42, it was 42. Hello? We can't hear you. Dr. Farombi, we can't hear you. Okay, while we wait for her to come back, I think the network is playing some trick. Could we all just turn on our video so that we can take a snapshot and then we can switch it off again? It's going to take just 1 second. Could we all just turn on our videos so that we can take a snapshot? We're waiting. Can you just turn on your videos so that we can take it up, please? Okay. Not too many people. We have a lot of people who have not turned on their videos. Or you can put on your pictures. All right.
Recording in progress.
Doctor.
Yes, please, sorry, yeah.
Doctor.
Sorry, I'm trying to join. I just joined with my phone now. Hello?
Yes,
Hello, can you hear me?
Yes, we can.
Hello, can you hear me?
I can hear you. Please go on.
Yes, the network here is a bit fluctuating. Sorry about that. So like I was saying, it's important, of course, to guide the patient. Let's say the patient vomits as a result of the stroke. That is not the time to lie the patient flat. You want to sit up the patient in like a normal sitting position. The reason here is to avoid aspiration, is avoid the debris of the food that the person vomited to going into the lung that can actually worsen outcome. Another thing is that somebody can actually present with seizure following the brain attack, and that is not the time to be trying to put spoon around the person's mouth just to prevent him from biting himself. That is not. It's just to allow him lie down in a left lateral position and put pillow, like at least 2 pillows, so that he won't be lying flat, so that he won't aspirate. So these are just simple first aid. But aside that, and guiding the person from falling, aside that, the best thing when it happens is to see that you bring the person to the clinic as soon as possible. Let me tell you something, the delay here can be catastrophic. And we say from door to needle is 45 minutes. 4 to 5 hours, 4 to 6 hours. Anything more than 6 hours, there's almost absolutely nothing anybody can do at that point. We will only just palliatively manage the person. But for full recovery, in places where there can be intervention, then that we would have prevented that person from getting that maximum care. So please, even while you are treating elderly people in home and you noticed it, the first thing is to ensure that on route the hospital, you can be doing the first aid, but at least make sure that you get to take the patient as early as possible to meet the doctor.
Thank you very much, Doctor.
I hope I answered the question.
Yes, you did. You did. I see somebody here from Society of Humanitarian Action in Aging in Africa. Could you say one or two things? Could we have a word from you?
Could I what?
Could we have a word from you?
Okay, yeah.
From you.
My word here is that stroke is common now, and is that, hello? Can you hear me?
Yes. Who is speaking?
Okay. Yeah, my word here is that stroke is a
no,
brain attack.
It wasn't actually you. I have somebody.
And it's commoner as we grow older.
Okay.
And we should be able to identify symptoms and present it. Yes?
Okay. Actually, I wanted somebody from Society of Humanitarian Action in Aging on Aging to speak, but
okay.
Yes, I haven't taken your final word, so I will still come back to you for your final word. Thank you very much. Somebody is asking about herbal medication. What do you say about it in the administration on stroke?
There is no room for herbal medication in stroke care. Please and please. Please, it's a red flag. You will worsen the outcome. Why? Let me explain why herbal medication. Herbal medication, some people might have seen it work, but it has not been tested, and you cannot gauge the dosage for herbs as it's right now. So you have to be very careful. And some things in the herb can be injurious to the body, even if some are good. So there are options whereby somebody will have take good one and the bad one. And the good one will do the good work and the bad one will do the bad work. But so there's no place for herbal medication in stroke care. Please and please let us desist from it. It is one thing that I am very, very passionate about. There is no place for herbal medication in acute stroke care. Please. So let us desist from it.
Okay, thank you very much. At this point, we have Alzheimer's Disease Foundation. Can we have a shout out from you? Do you have anything to say? All right. Nothing. So at this point, we want to actually come back to our speaker and say, what are your last words before we sign off?
Okay, thank you very much for having me. I'm happy to enlighten us on the importance of stroke prevention. Please, prevention, they say, is better than cure. Make sure that as an elderly or someone who takes care of elderly, make sure at least you do your full body checkup twice weekly. You enjoy and you do lifestyle modification, do regular exercise, watch what you eat, and be full of life. And perhaps having done all that and you experience symptoms of stroke, present to the hospital early. Thank you.
Okay, thank you so much. At this point, I want to thank you so much for always availing yourself to COSROPIN all the time. Every time we call you, you're always willing at no cost to take on this humanitarian venture. So we're very grateful, Dr. Farombi. We really appreciate you and your expertise. And we know that anytime I call you, you would always be there. And I want to say thank you, a huge thank you to everyone that is here and everyone that has made our time to be here. I can see one of my big daddies in the house, Daddy AIG. We have also so many people here. I won't want to start calling all the names, but we really appreciate your time and being here. Hope next time in the next 2 months, when we come back with the same program, you will be there to listen. And thank you for being here. God bless each and every one of us in Jesus' name. Thank you. Thank you. I'm signing off as the Secretary General, Reverend Victoria Onu, on behalf of the Coalition of Societies for the Rights of Older Persons. Keep fit and keep looking good, even in your older years. Thank you. Bye. Yes, you can.